All right, welcome everyone to today's discussion about Claroty's recently published State of CPS Security Report, Healthcare Exposures 2025. My name is Mike Mimoso. Joining me is Ty Greenhall, and we are going to talk about some of the findings in the report, which is available for you for download on Claroty.com. Just a quick email registration there, and you get access to the report. Just some quick highlights. We looked at over 2 million connected medical devices and OT systems within our data set. There were more than 350 hospitals in that data set, and we looked at where there were significant exposures on those connected systems. We're not just talking about vulnerabilities and vulns that have been patched, but we're talking about those that have known public exploits for them and known public exploits that are used by ransomware gangs. And we all know the issues with ransomware and extortion in healthcare. And we're also talking about whether these medical devices and hospital systems are securely connected to the internet. So these are huge exposures to worry about in a healthcare setting. They affect patient safety and patient care if they're exploited. So let's bring in Ty and get going. Good to see you. How are you, man?
Great. Glad to be here. Thank you for having me.
Yeah. So, of course. So just tell me, I know you were pretty intimately involved in the report. What stood out for you in terms of some of the data and just that whole context of exposures that we looked at in connected medical devices?
Well, first of all, I just got to say, 2.25 million medical devices. I mean, who's got that kind of data? You don't see those reports anywhere out there. And so for us to be able to have that type of visibility into the devices, I think is great. And that it wasn't just on the medical devices. There's the OT devices for the building management systems and the HVAC units and elevators and all those other things that if you shut those down, the hospital really shuts down as well. So it's a very comprehensive data set to begin with. So it's not like, just a few hospitals that we're looking at here. The T distribution is great. The other is across 300 some health systems, but out of that, all that data, 99% of those, all of those health systems have KEVs in them, and so there's just an immense amount of exposure. So I'd also say that
there's a huge attack surface.
Yeah, and it's growing, right? I mean, that's the other thing is it continues to grow as we're adding in all these wonderful devices onto the network, and so the exposure is growing dramatically. I would say that what's one of the things that's very interesting from a timing perspective, and you think about the relevancy of the report. We focus on in this report on kind of a Venn diagram type approach on taking a certain device type and then which devices have insecure connectivity combined with KEVs, combined with the fact that these KEVs lead to ransomware historically. So you put all those together in a Venn diagram, and we're pointing out things like 8% of imaging devices actually fall into that category, that Venn, that central point. So kind of with that said, what I think is super interesting is what's going on in nationwide. So at a national level, HHS is this last year determined there are 3 top attack vectors where bad guys are coming in and beating us and getting into our networks. One of them, top 3, is internet-facing devices with known exploitable vulnerabilities. So this report clearly helps identify not only just in general, but down to the device type, which ones are most exposed. And then also, on a volume and a percentage basis. But, further than that, you go, for those of you who are following, the whole HIPAA security rule update, they basically tried to put in the new cybersecurity performance goals. The number one cybersecurity performance goal they tried to put in under essentials was mitigate known vulnerabilities on internet-facing devices. So again, it's just, I mean, this report is so timely and really goes to validate all of the good work that the Department of Health and Human Services is doing.
Right. And as you kind of hinted at when you referred to the numbers around imaging systems, it's a really diverse set of devices that we're looking at. It's not just stuff that's monitoring patients, but it's diagnostic equipment like X-rays and MRIs and so forth. Why are these devices so vulnerable as they're connected? Is it just merely the connectivity, or is it just a design issue where they weren't meant to be connected and face these risks from cyber threats?
So that's what makes healthcare so different. Is it's all of that and more, right? It's
Yeah.
one that we start off. I think the term everybody knows in cybersecurity is if you can't see it, you can't protect it. So these devices, just from the very beginning, were never designed to hook to the network for the most part, because they're, the hospitals use these devices for a decade or more. They just put a NIC card in them and add them to the network and feed it information into the medical record, which is great from an efficiency perspective, but totally opens up those networks for entry in through those devices. So, just they don't communicate in standard TCP/IP language. So just seeing them on being able to find them on the network and identify them is, hurdle number one. Most organizations without a tool like Claroty's can't. And so just not having the visibility and then, scanning them, they tend to, not all of them want to be scanned. They don't have the capacity for having an agent to monitor them. They're just really not designed for, management with traditional IT cybersecurity tools. And so then managing the vulnerabilities, that's kind of, if you haven't been able to identify the device and you're not really able to communicate with it, and you're not able to it makes it determining what the vulnerability is, let alone solving the problem. So it's a complex problem.
I also found the OT data interesting in the report. I mean, I think it's really interesting because it illustrates that intersection of IT and OT in a healthcare organization. Everybody's got OT, and you got to manage it, whether it's the elevators, the HVAC, you name it, and it's just additional attack surface.
Without a doubt. I think when you take a look, healthcare is one of the 16 critical infrastructures we have. It's a little closer to home because, it's your health and your grandmother's health, right? So if something goes wrong, the effect is immediate. But the other critical infrastructures, they are largely manufacturing type of, having mostly OT tools or OT devices. But, water has been penetrated, energy. There's, the bad guys are coming into those critical infrastructures as well. So they know how to penetrate, manipulate, and cripple those types of devices, all of which are in a hospital on the network. And so, you cannot overlook those devices, because just because you shut one door, leaving all the others open, it is clear that the adversaries understand how to manipulate and penetrate OT devices as well.
All right, Ty. So let's wrap up. Just some final words of advice. How can security practitioners use the data, use the information in this report to help prioritize remediation, prioritize mitigation efforts?
Well, I think understanding which device types they might want to, with the highest percentages of being exploited, is a good start here. I believe that we employ within our solution the best process called exposure management, where you first need to define what the scope is for a hospital or a department or a device type, like we're talking about here. Then find all of those devices on the network. Thirdly, which is a little different here, which is not only look at the criticality of what the vulnerability is or what the vulnerabilities are, but the criticality of it, but how it impacts business operations. Because that is and other exposures. So you get the totality of which vulnerabilities do we need to go after first, because we've got limited resources. So that's a critical way of looking at vulnerabilities, but you need to have all of the data. A lot of it we're outlining it here in this report, then validate it, and then determine what the mitigation is and implement the mitigation.
Makes sense. All right, Ty, thank you so much for joining me today. There's a lot of great information in the report, and I urge everyone to check it out on Claroty.com, download it, and have a great day, everybody. Thanks for joining us.
Thank you very much.